Hello, I'm with Dr. Olivia Hart. Dr. Hart earned her bachelor's degree in chemistry cum laude and her doctorate degree in dentistry from Virginia Commonwealth University. Through years of running her own practice, Dr. Hart proved to her patients that she is dedicated to the highest quality of dental care. Dr. Hart completed hundreds of hours of continued education in areas of oral surgery, prosthodontics, periodontics, and orthodontics. She has a particular interest in cosmetics and holistic dentistry. Dr. Hart is a member of the American Virginia and Richmond Dental Associations. She is also a member of the Metropolitan Academy of Dentistry and IAOMT, International Academy of Oral Medicine and Toxicology. In addition, Dr. Hart is certified in sedation dentistry and is currently pursuing a doctorate in naturopathy. Following her belief in giving back to the community, Dr. Hart has been participating in mission trips and doing pro bono work for those who are in need. Okay, let me go with my first question. What is holistic dentistry, doctor?
Lots of the times patients ask me what's the difference actually between dentistry and holistic dentistry. So holistic dentistry, it concentrates on the whole body. There is a connection between mouth, oral cavity and the body. So when I look at the patients, I don't concentrate just on the mouth or just on the cavity or just on that problem. Lots of the times by looking in patient's mouth, you can diagnose something more and vice versa. So holistic dentistry basically is about looking at the whole body, about looking at the problem not just from the standpoint of the decay, but also looking deeper. So it's the connection between the body and the mouth. So that's what the holistic dentistry is about.
Do holistic dentists follow protocols, doctor?
Yes, we have certain protocols, and we definitely follow those protocols. They are set up by the organizations, and lots of them set up by organization which is called IOMT. And those rules apply, let's say, for the amalgam removal. So we follow the protocol for the amalgam removal. We protect you while removing the amalgams, and that there are certain protocols in place for that. That's just one of the examples, but there are some other ones as well. It is actually very important when you are looking for the holistic dentist just to check the credentials and see if they are members of IOMT, because those are the ones who are following all the protocols.
What precautions do you take when removing amalgam, mercury, and silver fillings, doctor?
So we have several things how we protect our patients. So we let them breathe the oxygen so that they don't inhale the mercury. Then we have the vacuum, which is set up underneath of the chin, so it vacuums all the vapors created by the removing the amalgam. Lots of the times we place rubber dam. We give them chelating rinse, and also there is certain protocol which they have to follow before and after the amalgam removal.
What materials do you use instead of amalgam, mercury, and silver, doctor?
Well, we usually for the fillings we go with the composite, which is safe biocompatible, and for the crowns we use either Braxier or we use different porcelain, so it varies, but all those materials are safe, metal free. If patient has certain allergies, they can always do the test, the biocompatibility test, which we offer to our patients. But as I mentioned, all our materials are very biocompatible. They are all, of course, amalgam free, but also metal free as well.
Moving on to our next question. Is cosmetic dentistry possible with holistic dentistry, doctor?
Yes, definitely. And holistic dentistry does not contradict cosmetic dentistry. We do lots of cosmetic procedures in our practice. In cosmetic dentistry, we definitely use very safe biocompatible materials. And holistic dentistry, it's also about be happy, be positive, and cosmetic dentistry, of course, helps you to achieve good cosmetic result, and that helps you to feel good about your smile.
What is the philosophy of your practice, doctor?
In our practice, we care about the patients. It's all about the patient. From the moment the patient comes to our practice, we treat them with high respect. We don't judge. We accept your choice. We give you the best option possible, and at the end of the day, we take your opinion and your decision. So you don't have to be afraid that we will judge you or treat you with disrespect. So it's all about the patients. It's about their choice, and we're always there for you. It's family practice. We are trying to make patient happy. So we would be glad to see everybody in our practice.
And our last question for you, doctor, is what are your future plans, doctor?
My future plans are to promote holistic dentistry in the community. I know it's very important nowadays. I know that lots of people are interested. It's something new for them. My future plans are try to educate everybody in that area. So hopefully our practice will grow. Hopefully we'll have more patients and more people who believe in more natural choices, who believe that the health is the health of the whole body. People who making right choices in food, in water, in their treatment options. So I really feel passionate about holistic approach, and that's my future plans.
Okay, thank you so much, doctor, for joining us, and thank you for your time.
Thank you.